Hello, I'm Colin Talbot, and this is the next in our series of interviews and discussions about how governments around the world are responding to the COVID-19 crisis. And for this session, I'm joined by three experts from Canada, by Lori Turnbull from Delhousie University. Unfortunately, you can't see Lori's picture because she's having problems with her broadband, so we're going to do audio only. Mel Cappe, who's a retired senior civil servant and is now at the University of Toronto, and Amanda Clarke, who's at Carleton University. Well, as you can see, none of us are at university at the moment. We're all at home like everybody else. So I wanted to get started just by asking you about the size of the problem in Canada. I was just looking at the numbers before we came on air. And I noticed that Canada so far has mercifully had far fewer deaths from COVID-19 than the UK. We're at about 15 times than the level that you're at, and certainly far fewer than your neighbours to the south in the USA. So I wonder if you could just say something about that. How big is the outbreak there? How localised is it? Because it looks like it's mostly in Quebec and Ontario. And is it within those, is it localized to urban areas?
Perhaps I could just begin because one of the unique features of Canada by comparison to the United Kingdom is regionalism. Now, I know that Scottish independentists would not accept that they're less independent, they're less different. But one of the interesting things about this pandemic is how it began in Canada was in British Columbia. And so they were ahead of the curve in terms of incidents, but then also got ahead of the curve in terms of dealing with it. Whereas when it came to Quebec, it came later to Quebec, but Quebec didn't get on it as fast. One of the important things for your listeners is to recognize the role of federalism in Canada, and that the administration of health services is done by provincial governments, and the chief public health officer of Canada is federal, who plays a coordinating role. But at the end of the day, the delivery of health services, and each province has a chief medical officer of health, but the delivery of health services is done by the provinces.
Okay, that's not too different from the UK in the sense that now the health service in Wales, Scotland, Northern Ireland has devolved to those areas, but obviously England's by far, with 85% of the population, the biggest chunk. Amanda and Lori,
Colin, just a fine point on that though. Devolution means that it still resides in Westminster, but has been given to the provinces on a devolved basis. In Canada, it's constitutionally the responsibility of the province.
Yeah. Mm-hmm. Amanda, Lori, did you want to add anything to that?
It's Lori. I think what I would say, in addition to the points that Mel made, is you're seeing a much more public space being occupied by provincial public health officers and, the chief medical officers in each of the provinces. So it's an interesting phenomenon in the sense that the pandemic has brought public servants very much forward, right? And they are doing the press conferences with the premiers often side by side. It is still physical distancing, and we're seeing that authority being expressed in public every day. And we're getting to know those public health officials who are working in each province, and we're seeing them, the different ways that they answer the questions. And the other thing I would say is that we've also seen a kind of localized phenomenon in nursing homes here. And so there's one in Ontario where they've really had an issue, and I think the last time I heard the number was 28 deaths. And so we are
out of 60 people.
Yes. And so there are some places, some communities where this is acutely tragic.
That's
Colin,
happening.
I would just add I just wanted to add to Lori's point, the president of the Public Health Agency of Canada has never been in front of a mic on this subject, because she has deferred to her minister, who is more senior than her, and the chief medical officer of health, who is more junior than her. But this is part of the lessons here is letting the expertise and the responsibility dictate who's going to talk to the public. And Lori's spot on and we've seen some of the better public health officers who have become local heroes.
That's interesting. Amanda?
Yeah, I mean, and I guess to speak then again to your question about, you know, for listeners, for those who are consuming this kind of outside the Canadian context, I think another feature of this that, you know, you have to understand is the reality of our shared border with the United States, which I think, I mean, in evaluating how big this problem is in Canada compared to other contexts, there's two things, I guess. One, there's the fact that we partially will always own how bad it is in the US, because we do have, even though we've closed the border, there's still quite a lot of traffic that will happen across that border in terms of Canadians who are in the United States who can come back. And I think the other reality that is something to keep in mind is also time-wise, part of why we don't really know how big it is in Canada yet is that we kind of came to this a little bit later, and our spring break, in which there's a lot of travel, only happened in Quebec, I guess 3 weeks ago, and in Ontario 2 weeks ago. And so we're only now starting to see the results of testing come out. So we don't, in Ontario at least, it's not very clear how big this problem is going to be. We're still very much, in the next week or so, we'll have a sense of whether or not we're flattening the curve, or whether we're going to have you know, really significant numbers. So it's hard to say how big the problem is right now, I would say, in places like Ontario and Quebec, and in other provinces outside of BC, as Mel noted.
Yeah, I understand the border issue very well. My nephew lives in Ontario and works in the USA part of the time, and he's had to be confined to Ontario for the last few weeks. So yeah, no, I get that one. Okay, just generally speaking, you've said that the provincial governments are much more important in the Canadian reaction, and Mel already alluded to the fact there seemed to be some differential reaction between the different governments at provincial level. And I just wonder how well prepared your government was, both at federal and provincial levels.
I'll speak to the federal level first. I mean, I think while the health response, the public health response is happening provincially, and we're seeing some variation there across Canada, but also I think great collaboration. The economic response and the kind of the stimulus and the social security benefits are coming centrally, and that's where the federal government has stepped in. And I think today we actually have a lot to be enthusiastic about. Just this week, we had the major rollout of one of the big benefits they've introduced, which is the emergency response benefit, which essentially is going to provide $2,000 a month for up to 4 months for those who've lost work due to COVID-19. And this is filling a gap in our system for those who aren't eligible for the normal employment insurance. And so that was just rolled out on Monday. And on Monday alone, the system received just under 790,000 applications, alongside normal employment insurance benefits for those who are out of work. We're seeing, 3.5 million Canadians applying so far, and 2.4 million of those applications for employment insurance have already been processed, and checks are going to be in the mail. So, I mean, I think one of the things that, this sort of a situation imposes on a system is really like a stress test. I mean, it's showing sort of what works in the Canadian system of government and where we've got some gaps. And certainly, someone who studies public administration, you look over kind of decades of reform efforts, and the goals are usually the same. It's like, government needs to be more agile, we need to be more collaborative, we need to move resources around more efficiently, and, we need to stop being bogged down by process and hierarchy and rules. And in this crisis, when you speak to civil servants working at the federal level who've pushed out these massive benefit programs and handled this huge surge of applications, they say that they were capable of doing that. People were redeployed, departments were instantly collaborating to share platforms, to share websites, to coordinate their communication strategies. There was rapid user testing of new programs that were put out. Just this week, there'll be a new product being launched in partnership with the Digital Service around a sort of a tool to just determine which of the many new benefits that are available you're eligible for based on your situation during the pandemic. So that, I think, has been really promising. So there will be a kind of fleet of civil servants who emerge from this federally who have experienced kind of what a Westminster bureaucracy is capable of at its best, when the pressure is on, and that you actually can be quite nimble in this system. It's not strictly a case of paper pushing bureaucrats stuck in process.
Can I just add,
sorry, Mel, can I just before you jump in, can I just double check on that, Amanda, because one of the big issues here is there's been lots of very good announcements from government about support to businesses and support to individuals, and virtually no money's actually got to anybody, even though those announcements were made 3 weeks ago. And I think that's a big issue. Can I just check? I think you said quite clearly that actually money's on its way out from the federal government, and that's
money's already gone. I mean, my daughter has already, she was laid off a week and a half ago, and she received her employment insurance check already today. The money is flowing. Amanda's spot on, though, that people rose to the occasion. The EI system, the employment insurance system, it was built in the 1970s. I used to be the chair of the Employment Insurance Commission, so I know more about this than I want to. But it's written in COBOL, has been patched together over the years. It deals with under 2.4 million applications a year, and it dealt with that in 2 weeks. So what Amanda's described is unbelievable. I doubted that they were up to it, and here they were, and they delivered. So I think it is really quite remarkable. Just one last point about being ready. The result of SARS. So SARS never hit the United Kingdom. I was there at the time. And because of SARS and the postmortem that we did, we created the Public Health Agency of Canada, which did not exist prior. And so that actually was a lesson learned and positioned us to deal with COVID.
Yeah, it's just worth reminding people watching this that SARS did actually transfer to Toronto, and so we didn't have it, but you did, and that was part of your response to that, is that you are better prepared than us. I just wondered if that we could just explore a little bit more about the differences in response at provincial level, because Mel said earlier that although the outbreak started in British Columbia, I see that the levels of deaths there are far lower than Quebec and Ontario, and I just wondered what had they done in British Columbia to get on top of it so quickly.
If I can jump in there, I think I think we are seeing some differences in terms of approaches that could explain to a certain extent why it seems to be so concentrated in Quebec. I think Premier Legault was one of the first people, the first premiers to come out and take this very seriously and declare a state of like a public health emergency. However, the measures in Quebec in terms of distancing and the opening and closing of restaurants and businesses and things like that, they were a bit more gradual. I don't know whether that was the reason why there are now more cases in Quebec, but it's when every other province was shutting things down, Quebec was still operating businesses at 50%, but that's all closed now. The other thing is that the city of Montreal is a hotspot. And I'm not sure how many of the cases, what percentage are coming from Montreal and surrounding areas. But one of the ways that the Quebec police the Quebec government is responding now is even the Ottawa-Quebec, like the Ottawa-Gatineau border, which is a provincial border, but runs through the city of Ottawa and the National Capital Region, and everybody crosses over it every day. That is policed now, right? And so you see a major police presence at every border crossing, just to try to manage the flow of traffic in and out of Quebec. And we know that other border crossing, like there are other interprovincial borders around the country that are being monitored as well. But this is a very heavy police presence on the Quebec border.
Okay. The another big issue that's come up in a number of countries is the level of preparedness in terms of supplies of necessary equipment in this situation. And the key issues that have come up have been around personal protective equipment, PPE, the supply of ventilators, and testing and tracking abilities of governments, and some have obviously been much faster at responding on all three of those than others. So I just wondered if there's differences, what's actually happened in Canada at the federal level around that, and at the national level, and whether there's been differences at provincial levels.
There has been a bit of an issue here there's been enough up until now, and the question is, will there be enough sustained? This led to a major border kerfuffle with the United States, where 3M was sending us face masks that we had ordered, and the president had directed that they not be delivered. That's now been resolved. The Deputy Prime Minister of Canada, the former Foreign Minister, had been in touch with her counterparts in the States, and that's been fixed. But this has become a major issue. I happen to also be the chair of the Canadian Blood Services, which is like the blood service of the United Kingdom. And this has been a big issue for our frontline staff. And we have been ordering from all over the world PPE that will hopefully protect them. And we have 3 to 4 weeks of equipment in stock and more on order. And the question is, will we be able to outcompete everybody else? And of course, we don't want to outcompete the frontline hospital workers. So there's this very delicate balance. And the deputy ministers of health are having I don't know if it's daily or every other day, telephone conference among all the provincial and the federal deputy of health to talk about managing some of the allocation issues that are implied in this.
Is that, can I just ask, is that supply managed at federal level and the purchasing managed at federal level, or is it at the provincial level?
It's a bit of both. There is a federal order, but it is each of the provinces competing against each other, unfortunately.
Right, okay. Amanda, do you look like you wanted to add something?
No, I mean, just this is by no means my area of expertise, but just based on what I've been hearing and reading as well, though, it is also a promising side of how federalism and interprovincial relations can work well, though, because there has been, at least, to date, a real sense amongst the provinces that they will help each other out. And I mean, the question is what would happen in the case of scarcity where everybody needs these supplies. But there is already, we're hearing really positive things about conversations between the provinces and the federal level. And this is important to remember, that we were coming into this, we weren't exactly in a great position with kind of federal provincial relations in Canada, where the last election showed significant divides, in particular the Western Canada, showing very different perspectives on what the future of Canada should be, in particular around things like resource development and pipelines. So to see that this crisis was able to show provinces and federal government finding common ground, and that there's willingness to work together and really positive relations, even where partisan politics have led to quite a divide, is actually, again, kind of a promising sign so far, and a sign that things can work.
That's good. Lori, was there anything you wanted to add? Sorry, I can't see you, so I'm trying to make sure I bring you in.
Yeah, I think that's a really interesting point on national unity, actually, because we really started seeing after the last, in the last federal election in Canada in October, the Liberal government was returned, but with a minority, having gone into the election with a very strong majority. We saw a prime minister who was then looking at a fractured opposition, so not totally threatened in terms of his the survival of his government, but really a kind of a parliament that was broken down along regional lines, and the opposition being sort of empowered by this regional concentration of their various pieces of support. And you saw provincial premiers like Kenny, like Ford, almost becoming an official opposition of their own, and really going at the prime minister and his deputy prime minister, Chrystia Freeland, on various aspects of kind of the Canadian agreement and how we are going to run the economy and what we are going to do for different regions to balance everything out. And now, since this pandemic has happened, you see the leaders taking a very different tone. And that doesn't mean all these problems aren't going to be returned to someday when things kind of go back to some kind of normal. But this has had a major, majorly transformative effect on the tone of interprovincial and intergovernmental relations in Canada.
Colin, there's a really important point implicit in this that I just want to underscore, and it is the role of leadership. Unlike Jared Kushner in the United States had just made this point about when you elect a leader, you're electing someone not for what they have done or promised to do, but what they do in an emergency or in a crisis. And what we've seen, and this has been a surprise to me, I will be very candid, the Prime Minister and each of the premiers have been outstanding in the way they've risen to the occasion and put the partisanship aside And so, as Lori has indicated, and Amanda as well, where there would have been divides, and typically the provinces would have been opposed to what the federal government was doing, they've been working together. It's quite remarkable.
That's good. Lori, do you want to make a final comment, because we're coming up against time now?
I think what I would say is, I think that in terms of readiness, like to kind of go back to the point about how ready were we, there are so many different elements of readiness when it comes to something like this. It is a public health crisis. There's a readiness in the sense of ventilators and equipment and hospital rooms and frontline staff. And it's almost impossible to be ready for something like that, in the sense that that's the nature of this pandemic. It's not that every single case of the disease is fatal. It's that we're almost, we're flattening the curve to try to outrun the thing so that the healthcare system doesn't get totally absorbed. And it requires, and I think there's so many ways that it has affected how we live and work together. But to me, I've seen, as somebody who's spending 8-9 hours a day on Teams meetings and Zoom meetings and everything else, the importance of trust. When we can't make eye contact, when we can't do all of the things that we normally do to sort of reinforce one another, it seems to me that there's so many different ways that we're seeing good faith and trust in various institutions and relationships become so important for us getting through this.
Amanda, yeah, we lost you for a while. You're back with us now.
Sorry about that. As I suspect is happening to many of us in these digital times. My phone died. I didn't realize that was coming. So here I am again.
Okay. We're just winding up. So I just wondered if you had any final comment you wanted to make on anything we haven't touched on that you think we should.
No, this has been great. A great conversation.
Okay. Well, thank you all very much for joining us. I'm sure we're probably going to have some of these conversations again in the future. We're also collaborating with the International Public Management Network to try and develop some of this further, and they're helping us to set up some further conversations with people in East Asia, some of the countries that have done particularly well in tackling it there. And there's, if you have a look on the YouTube channel we set up, there's already an interview there with Clay Westcott, who chairs the IPM network. So thanks very much for joining us. I'm going to stop recording now. Thanks very much, guys, and keep well and keep safe.
Thank you very much for the opportunity. It was nice to talk to all of you.
Yep,
Wash your hands and don't touch your face.
Thank you.